Good evening, everyone. My name is Patrick Gavin. I'm the CEO of Hunterdon Healthcare. On behalf of our 2,800 employees and in excess of 400 physicians, I want to welcome you to Hunterdon tonight. I'd like to take a moment to thank the Partnership for Drug-Free New Jersey and the Horizon Foundation of New Jersey for their help in making this event possible, and especially making it possible here in Hunterdon County. We're happy to continue our partnership with the Safe Communities Coalition and the Hunterdon County Prosecutor's Office as we work together to help improve the health and safety of our community. I want to applaud the continued efforts of the Safe Communities Coalition in providing education around the dangers of misuse and abuse of prescription drugs, including proper disposal of those medications. I commend Prosecutor Williams for his passion and dedication in reducing the heroin epidemic here in Hunterdon County. With so many overdoses occurring across New Jersey, the need for prompt, compassionate, evidence-based intervention is necessary and essential. Thanks to a grant from the New Jersey Division of Mental Health and Addiction Services, Hunterdon Medical Center's Behavioral Health Department has implemented the Opioid Overdose Recovery Program. The goal of this program is to help release overdose survivors from the vicious cycle of addiction, increasing their chances of a successful recovery. As a healthcare organization, we understand that addictions are a serious illness, but treatable nonetheless. Through our Behavioral Health Department, we are proud to be able to offer our community comprehensive mental health and addiction services. Tonight, we will hear from an impressive panel of experts that know firsthand the impact that opioid addiction has had on individuals, their families, and our community at large. I would like to turn the program over to our moderator, Angelo Valente, Executive Director of Partnership for a Drug-Free New Jersey. Thank you.
Thank you so much for that nice introduction, and thank you for allowing us the opportunity to come here to your facility and for your hospitality. We want to first and foremost thank each of you for coming out tonight to join us for this conversation to knock out opiate abuse here in Hunterdon Medical Center, the community of Hunterdon and the county, hosted by the Partnership and Horizon Blue Cross Blue Shields of New Jersey. For all of you in attendance tonight, your commitment is being part of the solution to our statewide opiate epidemic. The Partnership and Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, has embarked on a new 2-year Knockout Opiate Abuse initiative to address the opiate epidemic through community outreach, prescriber education, parent education, and a statewide awareness campaign. This is the 6th of 21 Knockout Opiate Abuse Town Hall meetings that will be held, one in each county across the state in 2019 and 2020, to help address the opiate epidemic and develop solutions at the community level. Now, we all know New Jersey is in the midst of an opiate epidemic. There's not a day that goes by without hearing or seeing a story in our neighborhoods or in the media of the impact of the misuse of prescription medication, heroin abuse, the countless overdoses impacting all of our communities, and so many of our families dealing with the day-to-day challenges of this crisis. The Hunterdon Medical Center community is not immune. No family, no community. And today we gather to learn more about how communities can address the epidemic, how individuals can make a difference in fighting the crisis, how we can prevent more New Jersey residents from becoming addicted, how we can reduce stigma, how we can help those who are addicted, how we can support those in recovery, and how we can bring awareness to this crisis. We know that there are no easy answers to solving the opiate epidemic, but there are always ways each of us can make a difference in this important fight. It is necessary for everyone, parents, community leaders, students, and residents, to all work together as a community to develop ways to end the epidemic and change the public attitudes towards addiction. This town hall and other efforts to educate and empower New Jersey residents are important steps toward making that change, which ultimately we believe will reduce opiate abuse here in Hunterdon County and throughout the state. It's now my pleasure to introduce one of our partners for today's town hall. Representing Horizon Blue Cross Blue Shield of New Jersey, Dr. D.V. Palival. Doctor?
Hello. It is my honor and pleasure to be here this evening to speak on behalf of Horizon and to welcome you all to this very important town hall on the response to the opioid epidemic. Thank you, Angelo, for your introduction and leadership, and thank all of you for your interest and attendance. As the state's largest and most experienced health insurer, Horizon Blue Cross Blue Shield of New Jersey is dedicated to improving the lives of all New Jersey residents. That is why we are proud to work with the Partnership for a Drug-Free New Jersey to bring you tonight's town hall as part of the Knockout Opioid Abuse Town Hall series that is taking place in communities across New Jersey through 2020. This collaboration is part of our company-wide focus to use all the resources at our disposal to help end this public health crisis in the towns in which we live and work. The Town Hall series and many efforts are being funded through the Horizon Foundation for New Jersey, the philanthropic arm of our company. The grant of the partnership represents a large portion of the $1.3 million the Horizon Foundation has awarded in grants since 2016 to help educate New Jersey residents about the seriousness of this opioid epidemic and what is being done to address substance use disorders. This issue impacts every community in New Jersey. With more than 3,100 drug-related deaths in New Jersey in 2018 alone, it is clear that more needs to be done. We need more people to become a part of the solution. And as a primary care physician, I'm drawn to not only how do we address and support those who are impacted today, but how can we get ahead? How can we proactively prevent such crises from occurring? Through our collaboration with the partnership and other state and local nonprofit agencies, we are committed to using this Knockout Opioid Abuse campaign to combat the opioid epidemic through community outreach, prescriber education, parent education, and a statewide awareness campaign. Tonight, we will hear about the impact of opioid epidemic in your community and the steps being taken to address it. In closing, I want to thank Hunterdon Medical Center for hosting us and to Hunterdon Healthcare for collaborating with us to present this town hall. I also want to thank our distinguished guests and our panel of experts for their participation. Together, we can make a difference in combating this epidemic. Thank you.
Thank you, Doctor. Law enforcement plays an important role in addressing the opiate epidemic. Next, it's my pleasure to introduce and invite the Hunterdon County Prosecutor Michael Williams to deliver some welcoming remarks. Prosecutor?
Good evening, everyone. First thing I would like to say is I think probably most people think of a prosecutor's office as investigating crimes and prosecuting crimes. And that's certainly our core function in Hunterdon, as it is with all 21 county prosecutors' offices in New Jersey. That's not the only thing we do. I think people might be surprised to learn that we also do a lot of outreach. We also do education. We do training. We do a lot of other functions other than investigating and prosecuting crimes. And one of the problems that we want to deal with here, and in fact we are dealing with, is the opioid crisis in New Jersey. And I just want to throw out some statistics there to kind of give a perspective for just a few minutes of what we're really talking about here. Between 2006 and 2012, 76 billion, with a B, opioid pills were prescribed in this country. In 2010, on average, 2 people a day in New Jersey died from opioid overdoses. It took 6 years to double that amount to 4 people a day from 2010 to 2016. It only took 2 more years from 2016 to 2018 to double again to more than 8 people a day dying from opioid overdoses. Those are very sobering statistics. Part of the big reason for that is, of course, more drugs being used, but also it's the introduction of fentanyl into the drug realm. It's an extremely potent drug. It was originally designed as an anesthetic. In the last quarter of 2018, 62% of the drug cases that my office prosecuted and arrested people for had heroin with fentanyl in it. Standard size business envelope. This envelope could hold enough fentanyl to kill tens of thousands of people. That's what we're talking about. That's how deadly this is. Put this in perspective a little more. Opioid overdoses are now the leading cause of accidental death in this country, 5 times more than car accidents and guns. That's pretty horrible, actually. To give it a little more personal effect, each year in the last decade, the equivalent of a small New Jersey town died from opioid overdoses. Think West Amwell, think town of Clinton. Each year this decade, that number of people died. I just want to talk real briefly before I sit down and we go to our panelists about 2 things that our office does do. Because I mentioned before, it's not just investigating and prosecuting crimes. We participate in 2 different programs. One of them is Operation Helping Hand. For those of you that haven't heard of that, that's a program through the New Jersey Attorney General's office, which obtained a grant, and every county in New Jersey, all 21 county prosecutors' offices, participated in the grant. $2 million is available from 2019 to 2020. And what we do with the money is we identify drug users through law enforcement means. We direct them to treatment, recovery, and support services if they want it. We do public outreach. One of the partners that we do that with is Prevention Resources. You'll hear from Leslie Gable in a little while. We also do contact with prior overdose victims. And we also use recovery coaches, individuals who themselves were drug addicts that were willing to come and talk to people that have a drug problem. Often they're people that we arrest, but it's people that they can relate to, someone that they might listen to more than they would listen to a law enforcement officer or a mom or a dad or there's someone else in their family. The last thing I want to talk about is the Overdose Fatality Review Team. This is a relatively new group within New Jersey. In fact, there's only 3 counties. I believe it's Ocean, Monmouth, and Hunterdon participate in this program. It's run by the director of the County Department of Health, Karen DeMarco, and what we do is we study cases of individuals who have overdosed and died and review their individual facts, their individual situation to see if we can come up with patterns, see if we can find up with connections between different cases. And our partners there are the DEA, New Jersey High Intensity Drug Trafficking Area Group, and Hunterdon Healthcare. So as I started, I just want to finish. The prosecutor's office is not just about catching bad guys and putting them in jail. It's far more, there's far more that we do. And I want to let the public know that that is an important part of what we do. Thank you.
Thank you, Prosecutor Williams. Now, today's town hall is about learning not just from our expert panelists, but also from all of you. We want to share how this epidemic is affecting your community, what's working in our county to address it, and what's not. The questions you have or the recommendations you want to share. It's vital to hear your feedback on this issue. The fact that each of us was given a survey that you can complete at the conclusion of tonight's town hall will give us information which will provide us with an understanding of how this opiate epidemic affects your community and how the partnership and Horizon can most positively impact communities at future knockout opiate abuse town halls. Everyone that completes to the survey this evening and hands it to the staff at the end of the event will be entered into a drawing to win an Apple Watch courtesy of Horizon. At this point in time, we'd like to introduce, for some introductory comments, our expert panelists. It's my pleasure to introduce our speakers for this evening. First, we have Dr. Nimish Mehta, Physician Coordinator for Pediatric Emergency Care, Pegasus Emergency Group here in Hunterdon Medical Center. Doctor, would you like to join us? Our next panelist, Nava Bastallo, who's the Public Health Analysis for Overdose Response Strategy for New York, New Jersey, HIDTA, Intensity Drug Trafficking areas. Next, we have Leslie Gable. She's the Co-Executive Director and the CEO of Prevention Resources. Next, we have Greg Rearick, Supervisor of the Huntington Opiate Overdose Recovery Program. We have Dr. Jeffrey Moore, Superintendent for the Huntington Central Regional High School. And we have with us Heather Ogden, Advocacy Coordinator, NCAAD, New Jersey. We'll ask each of our panelists to please take their seat. We're going to begin this evening with a question for the doctor, Dr. Mehta. Can you discuss the opiate epidemic from a public health perspective, and what is the medical community doing to address this epidemic?
Well, first of all, is this microphone? Oh, it's on, all right. Well, first of all, I want to thank everyone for coming out tonight to discuss this very important topic. First, I wasn't sure if I was going to start this way, but I think it's the right way to start. I want to personally apologize on behalf of the medical community. When I say the medical community, I'm talking about the pharmaceutical industry, regulatory bodies, physicians, providers, because we all had a small part in contributing to this epidemic. I wasn't sure if I was going to start this way, but I think it's important that we all take shared responsibility. And by doing that, we can certainly, hopefully, fix this horrible epidemic. In terms of what we are doing, at Hunter Medical Center, we have started a program where we actually monitor providers, physicians, and their prescribing patterns when it comes to opiates. For example, there's monthly reports that come out looking at individual providers when they're compared to their peers to see if there's any outliers in terms of the amount of opiate prescriptions that are coming out. In terms of the emergency department itself, we see a lot of patients who have pain as they're presenting complaint, whether it's abdominal pain, low back pain, chest pain, kidney stone pain, bone pain. And in general, we prescribe less than 5% of those patients that come in get an opiate prescription. And why is that? Well, we've become more aware, of course, of the dangers of these drugs. And more importantly, we are trying our best to educate our patients, because that's our job. Our job is to educate our patients about alternatives, educate our patients about the dangers of these drugs, and hopefully, in the end, make a difference in this horrible epidemic. So I welcome all questions tonight, and I hope I can help you in any way moving forward. So thank you for this opportunity.
Thank you, Doctor. Just to take up a point that the doctor just made about educating patients, the state of New Jersey was the first state in the nation about 3 years ago to institute a mandate that all prescribers, doctors, dentists, nurse practitioners who prescribe an opioid have to have a conversation with the patient or the parent of patients about the addictive quality of the drug and also any non-opiate alternatives that might be available. So as the doctor mentioned, it's such an important part of the solution to this epidemic. I'm pleased to report that this law that was passed in the state of New Jersey, that the partnership, Horizon, and many others were huge advocates for, has now been adopted in 16 other states across the country. So I think what we did in breaking ground with that legislation is really significant, and hopefully as we go through the town halls, we'll discover other ways to be able to make the opiate epidemic reverse the trends that we see and help people along the way. Thank you, Doctor. Next for Nava, what is the goal of the overdose fatality review team, and how might this initiative benefit Hunterdon County in the fight against the opiate epidemic?
Sure. Thank you so much for having me. So going back to what the prosecutor said earlier, that Hunterdon County is the third county that started these fatality review teams. So these teams were started with partnership with DEA, HIDA, Office of Local Public Health, State Department of Health, in order to reduce fatal and non-fatal opioid overdose across the state. So these teams compiled together in a jurisdictional level in order to review confidential death cases in an individual basis. So these review cases are done in a private and confidential basis, and at the same time, the goal is to prevent future death. And it is not to provide or do any kind of past investigation, but to figure out what went wrong in the system. It is to do some public health work at the same time, prevention work. It is to figure out what went wrong as far as gaps in policies and identify what went wrong so that you could help the other 20, let's say, that might go through overdose in the county. Also, it is to build working relationship among stakeholders. So there are public health, public safety partners that come to the table that wouldn't on a normal basis. And like it was mentioned earlier by the doctor, it is to bring everyone to the table and say that we cannot work in silos anymore, and use data to identify and bring changes, bring system level, policy level changes in a county, state, and ultimately national level.
So now are they looking at some consistent patterns that might be developed in this analytical work?
Sure. So at our state level, it's mostly in an infancy, right? However, at the whole national and other states have identified reoccurring themes that you'll see definitely needing naloxone training, throughout the state, or the with first responders needing naloxone training in hotels, motels, the venues that you might not have thought of at first places. So also, there's so many recommendations that could come forth, such as doing case management for these individuals who go through substance use disorder, workforce development in order to assist those in recovery, and various programs that should be in place in order to address the adverse childhood exposure, childhood trauma. And with that, DEA also has a program that is Newark Cares. Some of you might have heard of. And the biggest things that we are hearing is the need to break down the data silos, the need to, have data sharing platforms. We need to stop saying that HIPAA or FERPA, is limiting the data sharing needs in the state or even at a national level. And we're all working to bring that change. We want to bring probation services to the table. We want to bring school systems to the table as well. Or if we can't get to them, we would want to, go to them and not, say that HIPAA cannot let us do our work. So there are a lot of changes and recommendations that can come forth with just people sitting at a table on a monthly or a quarterly basis.
Excellent.
Thank you.
Thank you, Neva. Next, we're going to go to Leslie, and the partnership has worked with Leslie and her organization for decades, and she has been a real champion and advocate in the county, so we thank her. We all know that prevention plays an important role in addressing the epidemic. What programs do you have here in the community that are available to the residents?
Thank you, and thank you again for having us here tonight. I do want to just take a quick moment, if I may, explain opioids. I know when we've been out in the community, we are talking about opioids, sometimes folks are not sure exactly what we're talking about. So this evening, when we're talking about opioids, we're talking about things like prescription pain medicines like Vicodin or Oxycodone. The other things is it's also heroin and fentanyl, as the prosecutor was talking about. And the fentanyl that is out on the streets today is coming from overseas and being mixed and cut into the current heroin that we see, as well as counterfeit prescription drugs. And basically, you would say, why are they doing that? It's to increase profits, as well as increase the strength. So what's happening is if folks are getting addicted to a prescription drug and they no longer can get access or can afford it, is they move on to street heroin. And heroin, just to give you an idea, in our community, you can obtain for $3 to $5. So it's not very expensive, it's easy accessibility. So connecting that back to prevention is our focus through prevention resources, and our coalition is the Safe Communities Coalition. We work in partnership with many different entities to reduce access and to increase perception of harm. If we work at the root causes by focusing on those areas, those prevention programs become a lot more effective. While education is absolutely crucial, we find it's very hard to reach everyone and in a quick way. We've known and we've seen this epidemic changing ever so quickly. So what we've done is we've worked alongside of the DEA and the prosecutor's office and the sheriff's department to put in prescription drop-off boxes that are available throughout the county, and also in partnership with the DEA, which is wonderful. Twice a year, they do a big national push to clean out your medicine cabinets. It helps remind us to get rid of our medicines and put them in these drop-off boxes that, again, we have information out on the our table. If you're looking for locations, DEA Take Back, I hope I'm not stealing your thunder, is October 26th. Again, a national push. But one of the things, if we just relied on that, is we talked to our community and we found out that a lot of people were holding on to their prescriptions for many different reasons. Some due to cost, some due that they didn't have access. So what we've done is we've created a campaign, and this campaign is called Parents Hold the Key. And we find that the education, especially in home medicine cabinets, is to safely secure these medications. We know 70% of teens have access to home medicine cabinets, and that's where they start misusing prescription drugs. So again, it's a campaign to push to secure your medicines. The other thing I want to, Kathleen in the back, if you can raise your hand, she's back there. There's a table here. Partnership with the hospital, they have these prescription disposal bags. They're there for you tonight to take with you as an easy way to dispose of your medicines. I think one of the another really important way to educate is through our documentaries. And our documentaries we started out in A Split Second, which talked about a local teen here who lost his life of a prescription overdose. And we then unfortunately moved on to Pills to Heroin. Pills to Heroin we utilize across the state, but also in schools and town hall meetings. It is a 13-minute documentary, and they're explaining the stories of real people here and what happened with their addiction, as well as to encourage them to clean out their medicine cabinets. We've just recently finished a fentanyl factor, and that is, again, educating the community about how deadly fentanyl is. Most people aren't even aware of counterfeit prescription drugs, and so this is a new education. It'll be launched at our fall conference on October 25th. And I want you to know these films are free to everyone. Anyone can use them. They're on our website. But these programs are only as good as we can get access to people. And so one of the other things is in partnership with Hunterdon Central through Teen Safety Nights is the mandate that they have their junior year is for teens to come out, and we work in partnership with the school to educate parents and teens. And I tell you, it's probably about the only place that we can see about 800 families at a town hall meeting. And again, thank you to Hunterdon Central for that partnership. And I know the doctor was there, he said last year with his child. So please know that we work in partnership with all these different ways, but the best way we can do in prevention is to not have even one person start. And that's not just with opioids, it's with underage drinking, it's with marijuana. I've never come across anyone that's in recovery who haven't used heroin that haven't also had some association with marijuana. So please know in prevention we focus on all substances. And I'd again like to thank the partnership for including us. I'd like to thank everyone for coming here tonight. We have lots of other initiatives that are up on our table. So again, thank you so much.
Thank you, Leslie. And I just want to add to the some of the comments Leslie made about the importance of the take-back. Just for your information, the take-back program started here in New Jersey. New Jersey was the first state to hold a statewide take-back program, which Leslie participated on, and it was coordinated by the DEA, the partnership, and the Office of the Attorney General back in 2009, prior to the DEA's annual take-back days. And the DEA, on a federal level, used the model that we created here in New Jersey to take the take-back program around the country. So we appreciate Leslie's support early on in understanding the important role of making sure that those medicine cabinets don't have medicines in them that could become highly addictive for children and for adults as well. Next, we're going to ask Greg, how does the opiate overdose recovery program operate, and what impact is it having on our community here?
Okay, thank you. The Opiate Overdose Recovery Program operates I have a team of 6 peer specialists who are living a recovery lifestyle. They had once struggled with drugs or alcohol and are now drug-free. And they're available 24/7 if a Hunterdon County community member has an overdose and is Narcan reversed and comes to the emergency room, or if the police Narcan them and they refuse, we will come out to the person's home if the police call. And we attempt to take advantage of that near-death experience and have the peer specialist connect with them in only a way that somebody that has a peer specialist can. Oftentimes they have more of an impact than a doctor, a therapist, or a nurse. If we can get, we try to instill hope. We get that person to agree to engage and work with our team. And our team includes an intensive case manager that will work with that person to reduce any and all barriers to get them into treatment, to help get them benefits, to help get them social services, housing, a job, whatever it takes for that person to get on the path of recovery and wellness. I think it's had a huge impact. I believe we are saving lives. We're getting patients on the path to recovery. And we've had a very good success rate at Hunterdon. We were rated one of the top 2. It's a statewide program. We were rated one of the top 2 counties in the state in terms of our percentage of linking people to treatment and recovery efforts.
Excellent. Thank you, Greg. Next for Dr. Moore. As an educator, what do you think is the most important aspect of addressing the opiate epidemic within the school community?
Well, thank you, and thank you all for, I'm honored to be on the panel with folks whose work I admire so much. Honored, and tonight as an educator and as a parent, very concerned. When I arrived at Central in the summer of 17, one of my first acts was to offer condolences to the parent of a graduate who lost her son. And before that summer was over, we had lost several more. In one instance, three in one night. Graduates, and while it's true that the frequency of overdose in opiates is at a higher age bracket than the high school age, we know in education that the habits for and our hope is the habits against abuse can be built in the school. The proposition there, though, is under some threat. I mean, the very fundamental proposition of schools is an optimistic one. We all sign on to do optimistic work, yet we've developed some terrible expertise in other kinds of work. We are distraught by where we've been and where we are, but I am worried deeply about what's coming. Vaping, and particularly THC, has reinvented substance abuse in high schools in just the past 6 months. We've seen the rate at which students feel risk for substance abuse. We've seen that decline over the past several years in the context of conversations about legalization and other things. We, and as I mentioned, we lose students. We lose students and graduates to this crisis. The most concerning thing that I see from my seat is the intersection between this use and abuse and mental health concerns. After a certain amount of time, a certain number of infractions, cases of substance abuse come to the superintendent's office, and those students will come to my table, and I will have 14, 15, 16-year-olds at my table telling me that they're self-medicating. They are beyond our previous assumptions about adolescents don't believe it will happen to them. Adolescents believe they're invincible. That's not where we are any longer. I hear students tell me, while they may not know exactly what will happen to them or what impact it will have, they tell me yet that they don't care. They're using because they are fighting anxiety and depression. They're using to combat pain. And they're using gateway drugs, THC and alcohol and nicotine and everything else. We know that those drugs and that use isn't going to stop their pain, and so our concern, of course, is that they will begin to use other things. So our response at Central is much like any other schools in the sense that we offer counseling and services. In the past 2 years, we've increased the number of student assistance counselors that we have in the school. These are specially trained counselors with expertise in mental health and substance abuse. So we have one at every grade level now, which is a large number for a high school. But we feel it's important. The people are important in this effort. We have our partnerships, great partnerships with law enforcement, and both on the county and the municipal level. We have police officers in our school and are working to see with our municipality if we can increase that presence to help us in this and in other concerns that we have with Leslie's group, Prevention Resources. We've been expanding our partnerships with them. Right here in the medical center, we have our best partners, some of our best partners as well, in the school-based therapists that we have who are right there on campus. So we have an awful lot to bring to this fight, but I continue to worry about this notion that the Goliath we face is larger than any of these individual things, and this pile of stones we have might not just be big enough. I think we need to really seriously begin to reconsider the whole proposition of what we're offering to adolescents in this country, not just in schools, but throughout our communities. We are so busy about and around them. We are standing there, putting our hands on their backs, and we start running with our expectations and our demands for them. They struggle to keep up with that push for fear of stumbling. We need to follow them a little bit more, I think, than push them so hard. And so at Central, our work, and in our strategic plan, our work, we find, is to really come back to focus on relationships and engagement, connection, empowerment. These are the words that we feel should define education. And that's the work that all of our experience in both this realm and other realms of tragedy have begun to really teach us and crystallize our work in that way. In 1957, Russians shot a satellite into space that went around the Earth and beeped, and schools reinvented themselves to answer that crisis, focused on math and science because we as a nation would not be outdone. What are we doing now in the face of this? What are we reinventing ourselves on now? And we believe our leap of faith is that if we focus on relationships and engagement and empowerment, and we bring people to bear in connection with kids, that we can cover a lot of that distance for not just substance abuse, but everything that we face. This is a generation this is an amazing generation of kids. Some of you are out here tonight. You're amazing. You're amazing not just because you're here, but how you hold up and how you help each other. You will save us. I'm convinced of it. But I think we have some work to save you first. So, thank you.
Thank you, Doctor. Our last question for the opening is from Heather. Heather, can you tell us about how advocacy programs are important in helping people in both treatment and recovery?
Sure. Thank you very much for having me tonight. It's a very intimidating panel to sit on. I'll give it my best shot. So my name is Heather Ogden. I'm a woman in long-term recovery for both substance use disorder and mental health. I start most of my question-answer sessions with that because I think it's important for people to know that. I don't have a lot of the qualifications to masquerade on this panel, but I do have the qualification of I was one of the adolescents that the doctor here was talking about. And part of the reason that I ended up working in the advocacy realm is because I did a lot of what we call frontline work in recovery. I did work for an ORP, I worked for a recovery center, I worked with an in-community mental health program. Along the way, I got certified as a mental health peer, I got certified as an addictions peer, I got certified as a drug and alcohol counselor. Those were things that I wanted to learn because some of the things that we are doing is not working. So our system is kind of broken. And a lot of us know that. And seeing it frontline really gives you an idea of where the gaps in the system are. And the only way that we can really fix all of those gaps is to have all of the people from all of the different areas, like this panel, coming together to talk about our respective pieces in the puzzle. Because all of these things lead up to what causes somebody to develop substance use and mental health issues. We all know that it's not one thing. We all know that it comes from many different areas. But I was very intimidated for a while, the idea of talking to my elected officials, of thinking that I had a voice that they would actually listen to. That was something that was a very new idea to me. So I started advocating with NCAD about 8 years ago, and I was on one of the teams. So we have 12 advocacy teams across the state of New Jersey that encompass all 21 counties, and they are truly grassroots advocacy teams. It's comprised of people in recovery, professionals, family members, allies, and we concentrate on what each county needs. So I've been a New Jersey resident for 16 years now, but I was originally from Pennsylvania, and when I first moved here, people told me that whole, there's a North Jersey, there's a South Jersey, and then there's the question mark about the Central Jersey. When I started this job and traveled to all of the counties, there's 21 New Jerseys. Every county has their own issues. We have a lot of the same ones, but based on the demographics and the actual individuals that live in your counties, your county needs are different. So when I first started doing this, I went to each team and I said, you tell me what your county needs. And that's what each team does. So our Hunterdon advocacy team, when I first started, talked a lot about alleviating stigma. And that's a large part of what NCAD's advocacy programs, that's what we do. Language is very, very important. And I visibly wince every time I hear somebody with a microphone say drug addicts or alcoholics. I introduce myself as a person in recovery because that's who I am today. And people that are in active use are still people first. And that's something that we try and get across. And so part of what we do with all of our advocacy teams, but we started with the Hunterdon team as well, is we do some language trainings, we do some advocacy trainings, and we meet and we talk about what your county needs. So we also talk about how you can make a difference with your legislators. So I can tell you now that I actually go and talk to legislators, they don't want to talk to me. Only the ones that I can vote into office want to talk to me. So the ones that you can vote into office really want to hear from you. So the more people contact their elected officials from your little district, because I'm not even sure how many districts are in Hunterdon, but it's a lot, so you all probably have several different elected officials. But they really do want to hear from you. Let your voice be heard. Send emails, make phone calls. And we try and take that mystery away from dealing with elected officials. And then we do events that are very relevant to local communities. So in order to address language and discrimination barriers, the Hunterdon team is now doing a series of breakfasts in conjunction with the local faith leaders. So after services on Sunday, we have a breakfast. The team does the cooking. And we have people get up and talk about their own personal experiences, and it makes it very personal and very relevant, and it knocks down a lot of barriers that way.
Excellent. Thank you, Heather.
Thank you.
Thank you so much. We're going to, at this point, go back to the doctor and ask him about the prescribing habits of opiates. How have you seen that change over the last several years? And also, have patients' attitudes towards opiates changed as well, the patients you're seeing?
Yeah, there's been a dramatic change. To give you some idea, I mean, I've been doing this for about 20 years. So 20 years ago, when I was in my training, I was taught and told that giving a patient from the emergency department, 10 to 15 Percocets, no big deal. It's not going to lead to any kind of long-term addiction. It's not going to lead to any kind of future opiate misuse disorder, or as we call it now. And that was what I was taught as a resident. And when you're a resident, you're just like my daughters in high school, you believe your teachers. But certainly that's changed. Now we know that the best way to avoid a future opiate problem is to keep as many people as we can opiate naive. That being said, there are patients that certainly have.
Good evening. It is now quiet time. We provide a healing environment for our patients. Good morning.
Oh, that was weird. I thought it was like the Democratic National Convention, and I had the debate thing. Anyway, so as I was saying, I lost my train of thought. But anyway, so as I was saying, so we used to believe that, giving one prescription is not a big deal. But there are people that certainly need opiates. It's appropriate in the appropriate scenario. So our prescribing patterns have basically changed, that when we have patients that come in and we have good opiate alternatives, we try to maximize those. People believe that if something's over the counter, it's not effective. But the truth is, if you take a good dose of Tylenol or Advil or Aleve, when I say good dose, the doctor prescribed dose, they are very effective for the majority of day-to-day painful conditions, okay? So we really make an effort to keep people that have never been on opiates off of them. The second thing we do is almost always from the emergency department, we only give a short-term supply, maybe 2-3 days. Kidney stone pain, obviously a very, very severe type of pain. For that, we tell people use Tylenol, Advil, which actually do work pretty decent for that. And we only give them like 2 to 3 days. But at that point, the stone hasn't passed, we expect them to, see a specialist to get some help with that. So that's one thing. And the other side of it, I think you mentioned patients. Whenever I give a patient a prescription nowadays for opiates, they're always questioning it, which is kind of nice. I'm actually happy because, and it's also forced me and my colleagues to become better explaining while we're giving it to them. It becomes a discussion because they're like, well, I've heard about this on TV. This stuff is dangerous. Why are you giving this to me? And that's wonderful. That forces physicians to be better. I encourage my patients to ask questions. And let me tell you one thing about Hunterdon County. This county asks questions, all right? It's something I learned very quickly, and fortunately, over time with practice, I've become better at it. I think it's made me a better physician, and I have to, thank my patients for that. So those are the two things that have kind of changed. The emergency department, we never used to give 30, 40 prescription, pills in a prescription. We always gave 10 to 15. So it's more than total number of prescriptions that's definitely declined.
Excellent. Thank you, Doctor. Nava, just to go back to the overdose fatality review team, Have there been any specific recommendations that other teams in other states have given that have been implemented? Maybe you could share with the group about some of those recommendations?
Sure. So the biggest thing that has come about is the need, like I mentioned earlier, to share the data and also to expand this across 21 counties. So we just have, we also have a legislation in place at the state and assembly level that should help expand this across all the 21 counties and share that regional, that state collaboration amongst each other. And what has also mainly been recommended is that providing grief counseling and services to the families. Also doing some programs related to, like I mentioned earlier, adverse childhood exposures. There has been a lot of emphasis on public health, public safety partnership as far as collaboration amongst police departments and also social workers when they go out in the community. The police departments shouldn't be the only ones going out, but also subject matter experts like social worker should be going out as well to provide that family support and service. So having said that, although we had a lot of data from all the stakeholders on both public health, behavioral health side, provider side, law enforcement, like I said, our chunk of data comes from medical examiner's office and also the prosecutor's office, but that wasn't seen as enough in these counties, and they wanted to hear what the families had to say. They wanted to hear what went wrong in the person's life. They wanted to know the journey of that person. So recently we have hired a social worker who actually works as far as providing information or getting that information from a family member. So she acts like as a liaison between the state medical examiner's office and the next of kin. So she collects information from the families and provides them back to the state medical examiner, and that data piece, they also get the whole picture. At the same time, she provides this information back to the overdose fatality review teams, where you get to see what went wrong with the family, what happened. Sometimes we get to hear from the family as far as a brother might be speaking or a sister might be speaking. We get to hear a lot about domestic violence in the family or trauma and their partner using drugs or outside influence and so forth. So it's been a really eye-opening experience as far as what at an individual level and stakeholders like you could do, just by having overdose fatality review teams. Thank you.
Excellent, thank you. Leslie, you mentioned about some of the programs you had. Are there any challenges that exist that are unique to this community because of the demographics?
Oh, thank you. The challenging thing that we have that's very different with Hunterdon that I don't think people outside of Hunterdon County actually quite get, because our county is, as most of you all know, it's a very beautiful community. It's seen as one of the healthiest communities. We get all these recognitions as being a healthy community, which is wonderful. But however, it doesn't really take a look at what's happening here. The amount of pressure, and I think this speaks to what Dr. Moore was speaking of pressure that especially our young students, young teens feel, socioeconomical situations that we're in to perform at high levels, the stress that parents are under to compete within this community is very difficult. And that leads us to taking a look at from a resources standpoint. So Hunterdon County, while it's considered one of the wealthiest counties we have, is also from a social services one of the poorest. We get very little funding streams, and when we talk about funding coming in comparison our county to other counties, and they start to look at numbers, they're not looking at ratios, they're looking at single numbers. So yes, while our overdoses, for example, are not as high as some of the other counties, they're still there in a ratio, and that's not really looked at. So we really do get the least amount of funding, and we still have many pockets of areas of people that we need to reach and programs that are needed. Connection to treatment and recovery. For example, we don't have, while our agency's been trying to put together recovery services, there's no money for that. And what better way to put money in to help people stay in recovery? And I think that is just it's such a challenge to be able to get all these programs that are needed. And I will say, though, on a positive note, because I do want to leave it on a positive note, that while this county has these challenges, I'm looking at the faces out here and amongst the panelists that we all do work together incredibly well. And if we didn't have the partnerships to share in the resources we have, we wouldn't be in the situation as far as being able to offer some of the things. And I do want to get a shout out to all the young people that are here. Several of them are on our youth coalition. I won't embarrass them too much, but they do tremendous work. And we know, and again, building off of what Dr. Moore said, that and the advocacy, that they will be our voice, and working with our youth coalition is going to be really the answer to turning everything around, because they really do hold the answer to our future.
Excellent. Thank you, Leslie. Next for Greg. Greg, could you tell us, I know you talked about the opioid overdose recovery program. Maybe you could share like a specific example of a success story that program has had here in the county?
Yeah, sure. I actually can think of two successes, but one is we just recently had a call from my navigator, who is our intensive case manager, had a call from somebody that was getting ready to graduate from a 6-month rehab in northern Jersey, reached out to us based on our initial contact in the emergency room. My navigator went up and met him prior to him being discharged, and is now offering supportive services while he's out in the community to kind of smooth that transition from a long-term inpatient to outpatient.
Excellent.
And the other success I can think of is I think the emergency room has had a positive experience working with the peers, and I think somebody mentioned stigma earlier. I think that's had a big impact on stigma, and I think in terms of how sometimes medical professionals will view, they always see people active in the addiction, but it's nice for them and law enforcement to see that recovery is possible.
Excellent. Yes, Doctor.
I just want to give everyone a better idea of this, of the opiate overdose recovery program, how it works. So, in a more practical manner. So, if I get a call from one of the Hunterdon ambulances that they're bringing a patient that was reversed, I'm calling them right away. So many times they might be in the emergency department before the ambulance even gets there. Because one thing we know is people are in that cycle of overdose and they get reversed. When they get reversed, they are feeling miserable. They're already depleted of all the pleasure hormones, the dopamine in their brain, so they're feeling very down, and they're thinking one thing, and that's, I want to leave and do this again. So there's an opportunity there, and of course we can't hold them. So we're trying to get these people, our colleagues, in there as soon as possible. So it's been a wonderful program. If we can even save 1 out of those 10 people that we reverse, it's a success. That's the way we have to think of it. It's any movement in a good direction is what we're looking for at this point.
Absolutely. Thank you, Doctor. Next for Dr. Moore. What services are currently available in the school, and if you had your abilities, what services would you bring into the school to deal with this issue?
It's a tough question for schools, because schools are struggling with what level of service they ought to be responsible for, and that speaks back to what our mission is anyway, right? So if we're talking about the kind of focus that I've mentioned, relationships and engagement, it means a different level of service and more services than I think schools traditionally have. So right now we have quite a few services. I mentioned our student assistance counselors who handle mental health and substance abuse concerns, and we've increased their numbers over the past 2 years. In addition, we can refer students into our school-based counseling program, which uses counselors from the medical center here. We have new training for teachers and frontline counselors on warning signs and symptoms of all kinds of concerns. We've really been focusing our work and our training of all of our staff on building relationships and knowing kids and knowing when things look like they're not the way they ought to be. So we have a lot at our fingertips right there in the building, and then beyond that, through law enforcement and our partnerships with organizations like Leslie's, a lot of additional resources, everything from diversion programs to community-based education programs. You know, I feel like we have a wealth of resources. It's hard to think that we need more of that. I think what we need to be thinking about is, I think we're in the same conversation that all of society is in. When we have somebody who breaks a rule, what do we do with them? You know, I think that's the conversation that we're having, and that speaks back to our policies and our approaches. So where do we put supports in our responses to students who break the law? We have the supports, but where do we put them when we come upon a student who's broken that rule? Are they up front, or do you have to stumble a few times before you get them? The landscape of substance abuse now is such that the students are presenting THC, for example. The students are presenting with levels of THC in their urine, not to get indelicate, but levels of THC in their urine that are beyond anything that any of us have seen in our careers. So the expectation that that student's gonna comply with the same old regime of rules that we've always had, you're gonna come back and you're gonna be clean. That's not gonna happen. We have cannabis use disorder, where students are not necessarily chemically dependent upon this use, but psychologically and through a self-medication kind of context, they can't stop. So how do we handle that? We can't just deny them an education and say you can't come back until you're clean. So supports we have a lot of. It's arranging them in a way within the context of our rules and our consequences that I think we have a lot of work to do. And in that, I'm comforted that we're having the same struggles that everyone is having up and down in society, but I'm also frustrated that we don't yet have the answer because we're all dealing with it day in and day out. But services, I'm thankful for the partnerships that we have across the county and for the skills of all of our staff and the interest of the interests of our teachers and their kids and what the kids do for each other is just so amazing. I think it's up to us to put it all together in a way that makes sense so that we can answer this challenge and help move some students along toward a better lifestyle.
Thank you, Doctor. Last question for Heather before we go into some questions that we received and some questions from the audience. Could you tell us a little bit about your own personal journey and some of the barriers and challenges that took place during that journey?
Sure. So I said I'm a person in long-term recovery for substance use and mental health. That's since 2010 for me. I was very fortunate. I had a family that was supportive in wanting me to get well. I had really good insurance. So I was able to go away for 40 days and get really good care. But even that, I was basically sent home with okay, good luck. And I went to treatment in another state. So all of the initial recovery supports that I had made were gone, and I had to start over again. That's a cycle that happens a lot when we hit these gaps. So that was my first stumbling block, was to figure out how I could find the same kind of support that I had when I first found recovery. I did, and it worked for me. We've known for a very long time that there's nothing quite like the power of one person who's been there helping another person get there. And that works across the board, okay? It works for people in recovery. It works for family members. Family members need so much support. Siblings need support. We're finally catching up to the fact that we need more of these programs. And early recovery was very difficult for me. I knew that I had an underlying mental health condition. This was not a question of which came first. I knew which came first. I've struggled with major depressive disorder since I was a teenager. This did start out as a self-medicating thing. So when I got physically sober, I needed to deal with that underlying mental health issue. And this is extremely common, and the fact that we're still treating them as two separate disorders is a problem. because there is a major resurgence of mental health symptoms if you have them underlying. There's a major resurgence of them when you take away the chemicals. So I went through a very long process of trying to find proper medication and proper therapy and proper supports. And in some of the places that I would talk about it, I was told you're not allowed to talk about that here. So I started making places where people could come and talk about it because it was something that people needed to discuss. So my advocacy career was kind of very early, and it was built out of my own need. Stuff was missing, so we needed to create it. And because of my own personal struggles, and I mean, I had it a lot easier than a lot of people. I had a roof over my head, my family was still intact, I had great insurance and great treatment. I could come back to all of these bonuses, but that isolation piece is present in every person seeking recovery. It is there. It doesn't matter how many supports are there. You need the other extra supports in order to get it. So I never thought that I would look at that as one of the biggest blessings in my life, how hard it was for me to stay in recovery. But, you know, in my head, it was kind of against all odds. And if it was difficult for me with all of the benefits that I had, you know, a lot of people have many, many more social issues that they have to tackle in order to find recovery. So I made it, you know, a personal mission of mine to just let people know that, you know, recovery is real, it is possible, and there's a lot more of us out there than you'll ever know because a lot of people still can't talk about it. So that's where I started, and this is where I ended up, and
Excellent. Thank you.
it's a blessing.
Well, let's give a great round of applause to all our panelists doing an outstanding job. For the next phase, what we're going to do at this point is ask some of the questions that we received from some of you ahead of time and also from our live stream audience. The first question is, where can people in Hunterdon County go to get help if they don't have sufficient insurance coverage or the means to pay for treatment? And we'll open it up to anyone on the panel who would like to respond.
Well, I mean, part of the reason I became an emergency physician, because let's be honest, the emergency department is a safety net of our healthcare system. So we treat everyone regardless of ability to pay and insurance. So if, you know, certainly we have a wonderful behavioral health crisis team available 24/7 in the emergency department. So we're always there anytime. I know a lot of people are hesitant because of the cost and stuff, but you know, that's something that is can be worked out at a later time, and we will help everybody.
Excellent.
That's my short.
And I know also the state has a program called Reach NJ, and if you dial 211, there are individuals that will be able to provide you with assistance as far as potential treatment facilities that might be available. The next question we received was, my child had oral surgery and she was prescribed an opioid, but she wanted to avoid having them to take them. What are some of the alternatives that are available, and how can I speak or challenge my doctor when he or she prescribes them? Okay.
Probably was. I'm the person that has to answer that one. No, that's a good question. I mean, I do this every day. You know, so you're given an opiate prescription, and you ask, like, what else can I take? You know, is it going to be effective? You know, let's be honest. Like opiates, a lot of people have different responses. Some people just get tired. Some people are nauseous. You know, it's all genetic predisposition. Some people feel sicker taking them. You know, so I think the question is, what are the alternatives?
Right.
So I guess if I had oral surgery, which of course can be very painful, I might come. You sometimes have to come to a compromise. You know, the goal is to limit the use of opiates, perhaps more than just not use them at all. So you might say, well, during the day, why not use Tylenol at this max, you know, safe dose? Complement that with some anti-inflammatories, Aleve, you know, ibuprofen, and then at night, because when you're at night, you're not distracted. All you can think about is how much your pain, you know, mouth hurts. You might use an opiate. That's a lot better, say, using 3 pills in 3 days when the pain is maximum after surgery, rather than using 12 pills in 3 days because you're taking it every 6 hours. So that's just an example of something I would perhaps discuss with my patient. And I think in the end, that's going to lead to the best outcome in terms of pain control and minimize the use of opiates.
Yes. Specifically with oral surgeries, I know that Rutgers University just this past week received a significant grant to study alternatives for oral surgery, especially on adolescents. So hopefully real soon we'll be getting some information that's going to be able to be very specific on that with regard to that.
I'm sorry, just one other thing. The other thing is I know we're using actually immediate release morphine for oral surgery, and it's actually been shown that immediate release morphine, even though it carries a stigma, I believe, in the community, has slightly less addictive potential than oxycodone, Percocet, which has classically been used. It causes less of a euphoric kind of response. So that's something that's changing in the medical community you might see in the future.
The next question is, are there any plans to add a detox or inpatient treatment addiction facility in Hunterdon County? Okay.
There's a lot of, there currently is long-term, not that I'm aware of through the hospital. I know that they recently had consultants in and we're looking at that, but I haven't heard anything about that report. But there's multiple outpatient and IOP and other level care, and we do have we do use our detox, although it's not for opiates, here at Hunterdon. So, to be determined.
Okay. The next question is, how can I learn how to use Narcan, and do I need to have a prescription in order to get access to it?
Well, first of all, Narcan, anyone can, you can get it without a prescription, first of all. But as far as training, our office does do trainings every other month. So you can get the information out on the table. We have a partnership with Rutgers that comes out to do training, and anyone that attends the trainings through our office gets a Narcan kit. And if the Narcan is deployed or has expired, if you, again, they give you a contact to be able to replenish that. And again, that's through a special grant and a program that we offer at our office.
Excellent. We're going to be going to questions from the audience. There is a microphone, so if you have a question, just raise your hand, and Bill will bring over the microphone to you. And if you could speak into the mic, because we are live streaming this to residents throughout the county. So go ahead.
It's not really a question. I have a couple statements.
Please, go ahead.
Couple statements that I want to make. So my son died from a fentanyl overdose, and there were two things that really stick out in my mind as I've been thinking about it the last couple of years. One is peer pressure, and in the schools, I think it would be valuable to have certain kids that are stronger, maybe mentor other kids that might be at high risk when they first come into the school and they're looking to fit in. That might be a good time to catch them. And the other thing is the Partnership for Drug-Free Kids has a 20-minute guide, which is through the Centers for Motivation and Change, and it's evidence-based practice about how families can support their addicted loved ones. But we need to get that program in all the rehabs in the state of New Jersey. I don't know about building more rehabs, but if we don't treat the family at the point of contact when that person's coming for treatment and wants to get help, it's very hard for them to get well by themselves in a bubble. They really need the family support, and most families have no idea what they're doing. So I think that would be helpful.
If I can just add to that, we also have a family support center, and I'm actually looking at my colleague, Rocky, if you could just raise your hand back there. So we have an incredible team at our office that works with loved ones, just as you were mentioning, of someone who's suffering. And this family support center can really help build the support for the family, as well as we have family support meetings that happen. So if anyone's looking for information, again, we have it out on our table, and we just happen to have one of our coordinators here, Rocky. So please know that we have that service.
Yes.
If I could add a thought that your point raises for me, and thank you for coming out and sharing. I needed to hear what you were saying, and it was very important what you said. We are beyond certainly, I think we all know this, beyond the say no, just say no, this is your brain on drugs. We're beyond the scary PowerPoint kind of approach now. We know that when adults in a school face a problem like this and they prescribe some solution for the students, that we're going to get it wrong in some way, that the students are really the best source of how to get traction for the help and the message and something authentic that's going to matter. Your thought about mentoring is really important. When we began our strategic planning work a year or two ago, one of the first things that we heard from students loud and clear was that we don't listen to them. And that wasn't just kind of teenage angst of you don't listen to me. It was real. It's a real thing that adults don't always necessarily turn to youth as solution makers in problems like this. And they are more than capable to not only assist in the ways that you suggest, but to lead the solutions. And Leslie's group with their youth coalition is a prime example of that. But we see that more and more on campus. Just the resiliency of kids to take care of each other, to take care of themselves out of the duty that they know they have to take care of one another. It's powerful stuff, and we can trust them. We can trust them, and that's more of the work that we're doing at Central as well. But thank you.
Yes, thank you, and sorry for your loss. And just to share with you, I know from our perspective at the partnership, we get calls on a daily basis from families that are completely blindsided by this epidemic, and they need the support and help as much as the person is going through treatment. So we couldn't agree more that this is a family disease. This affects the entire family, and the more support we provide to everyone impacted, I think the better chances we'll have at success. There's a question in the back.
I have a question for Ms. Ogden. Is there anything that you wish you had known as a teenager before you started using, or anything that, like, would have, if you had known, would have, like, prevented you from started using?
That's an excellent question.
Excellent question.
Okay, so a little backstory. So the man I call my father is the man that raised me. So he's my dad in every way that counts. He's also in recovery for 17 years. My biological father died of alcoholism at age 33. So I grew up knowing that I had a very strong genetic tie to developing some kind of addiction issue. And then I lived in a household where there was an addiction issue as well. So I had all of these underlying mental health problems, but because I knew about that predisposition, I actually avoided alcohol and drugs for a very long time. I did not drink in high school. I did not do drugs in high school. And then I did what people in recovery would call successful use for a very long time because I thought I knew better. And that's part of the problem. And it's not just because I was a teenager, it was because since I grew up around it, I thought that I could avoid it. But I'm a mom today, and I have teenagers. And those teenagers still have that same genetic predisposition that I did. And I encourage them to postpone their first use. So I try and be as realistic as possible. I don't tell them, no, you should never drink and you should never do anything, because that's not necessarily realistic. My older sons watched me in my active addiction and they watched me in my active recovery. So they can compare that. But I know as an addictions professional that the longer you put off using, the less likely you will be to develop a problem. There is a direct correlation between the age of first use and developing a substance use disorder later in life. Substances do not react very well with an adolescent's growing and developing brain. If I, looking back, and that's what I encourage adolescents to do today, including my own children. But I did that, and I still ended up here. And it's because I did not learn how to cope with bad things that happened in life. And that's kind of my bottom line, and when I work with other people. That isolation factor, if you feel alone, find somebody, find your tribe. Don't be alone. Find the people that feel like home to you, friends, family, loved ones. Because if you are happy within yourself, you don't feel the need to use substances to get out of yourself. And I started using substances to cope with something that I didn't know how to cope with. That's the wrong way to cope with anything. There are much better ways to do it. And that's something that I try and encourage in my own children, is trying to teach them how to have a vocabulary and how to, for emotions and the bad things that happen in life. Because let's be real, bad things do happen in life to everybody. And you have to learn how to deal with it. We live in a culture that likes easy fixes. We like to have a drink or, take a pill. Life is a little bit more complicated than that. So I would encourage younger people to put off using substances until you are actually of legal age to use them. It will help with your brain development. And also learn how to talk about things when they're going wrong in your life. Find the people that make you feel better about that. And if you need help, ask for it, because it's out there. Don't think that you have to do this alone.
Excellent. Thank you. Any other questions from the audience? Just raise your hand and Bill will come right over to you. Bill in the corner.
This might be outside of the scope of the purpose of this meeting this evening, but my question has to do with what is being done to handle the other side of the coin, the supply side, and as well as trying to prevent either through legislation or through the action of government agencies, Drug Enforcement Administration, what have you, the military, the police, to prevent the distribution from, say, for example, fentanyl from other countries from getting into this country in the first place. I knew that some of this was being produced outside the United States. I assumed that, much like popular TV might tell us, that an awful lot of it was being produced in the United States as well. But I think half of the problem has to do with supply, and the other half of the problem has to do with the prosecution of people that push legal drugs that cause part of the opioid epidemic and as being thrust upon people. So it seems like another aspect to the things, the good work that you're doing needs to be addressed. So I was hoping you might be able to address it. If it is out of the scope, please feel free to defer.
Okay, well, I think that with regard to the potential settlements that might be coming down the pike with the lawsuits that are taking place, we can ask the panel what their thoughts are on whether or not those funds should be earmarked specifically for enhanced treatment and education programs, which would mean that it would go directly back to the people that are most impacted by it.
I'm going to jump on this one. Advocates are very worried about the upcoming settlements. So the biggest lawsuit right now is the one with the states against Purdue Pharmaceuticals. There are simultaneous lawsuits going on against Johnson & Johnson, other large pharmaceutical companies. History has shown that when a settlement of this magnitude goes directly to states, not a lot of that money trickles down to the actual problem and solution area. And we're afraid that that's going to happen again. So this is something where, advocates are attempting to get more people rallied behind this, because if we want to use this money to try and solve some of the problems, we need to get it to the level where we can actually solve some of the problems and help the people that need help. No one consulted with any of the families on these settlements. This is all state governments and lawyers. No one asked the remaining family members who lost loved ones or people that are in recovery as a direct result because of prescription opioids. Nobody talked to them. So there is actually another, we're hesitating to even call it a lawsuit, but it is a lawsuit. So Purdue has filed for bankruptcy as an immediate result of this settlement to the states. There is now a push, there are lawyers involved. They're trying to get the family members and the people in recovery to sign on for this because they'll be able to vote in the bankruptcy about how those funds are distributed. It's the only way that the people who were immediately affected by this will have a voice in how that money comes down. I really hope that the states that agreed to the settlement are going to use it properly. But that's something that we have to step up and say, guys, that's our money. You need to use it for these services and not just let it kind of get sucked up into the ether.
Anybody else like to contribute? Okay. Another question we have from that we received from the audience prior to arrival was, as a resident of Hunterdon County, how can I make a difference in addressing the opiate epidemic in my community, in my neighborhood? So is there anything that a person can do specifically in their neighborhood to make a difference with this epidemic?
Go ahead. Well, first of all, whoever submitted that, thank you, because we're always looking for people to join our Safe Communities Coalition because it is a community coalition. Every single person can contribute at any different level. We have many different initiatives that we're constantly needing people. Some of the best things that we have found is when someone is new, is looking at some phenomenal solutions that when you deal with this stuff day in and day out, you might be missing some of the most common things that could be put in place. So somebody who might think, hey, I'm not really an expert, we don't need experts. We need people who can come in and offer just their thoughts and their ideas, because that might also spur someone else's ideas. So please know, as far as in the community, some of the best things that they can do is to join our efforts, because we have many things. But the one thing, if I could ask that person who submitted, as well as everybody in this room, is to ensure that they go out and they make sure that they tell their loved ones or anyone they know about the Overdose Protection Act. It is something that we constantly do in the community because people's lives can be saved by somebody picking up the phone and calling for help. We know that there are people who've lost their lives because someone didn't want to get in trouble. And especially our young people that are sitting here today, to make sure that they know that they can call for help and receive amnesty under the law. And so that is a big message, that if we could have everyone ensure, a law is only good if everyone knows about it and, more importantly, that they use it.
Thank you. Youth athletes are particularly vulnerable because of their injuries that they receive and the fact that they get access to prescriptions at an early age. Are there any efforts here in Hunterdon County to work with, to provide athletes and their parents information about the opiate addiction?
Well, thank you, because I would get in trouble if I didn't. I had this sitting on my lap the whole night, and I would have gotten in trouble by many people for not showing this. This is actually a statewide partnership effort. We have these opiate toolkits that have been put out throughout every single county. We have one here. And in this toolkit, it basically connects all different services and resources for athletes, coaches, parents, athletic directors, school nurses, and there's a piece in here that's relevant for every different aspect. And the reason that athletes in particular are more vulnerable than any other is because the likelihood that they're prescribed opiates for injury. One of the things that we have found with athletes in particular as well is they will hide their injury. especially from their coaches, because they don't want to lose playing time. And the likelihood also is that they'll share their medications. So through our education initiatives and this toolkit is to make sure that the coaches and the school administrators are aware that we can put in programs, education, to be able to address their vulnerability. Recently, the AG's office also put out a mandate of a new video that's required for all athletes starting in the winter session, as well as there's an opiate fact sheet that all parents and athletes have to sign off on. And again, I want to thank Hunterdon Central, our partner, because they're one of the first ones that stepped up with this toolkit, and they've embedded the AG's required video. So now when parents and athletes go on to sign off that they've seen it, they'll have to go into the toolkit to see the video. And again, it's another great way through working in partners to change policies to ensure people get more outreach. We also have one of our retired detectives that is working with us to also go out, and we're working with policymakers, because one of the things that we'd like to see in Hunterdon County is a requirement and a mandate for all athletics to make sure that it's a mandate that they have this. So we're actually starting with a resolution and also looking at a way to change the policies here in the county.
Excellent, thank you.
If I could
Yes.
add a little bit there as well, I want to pick up on one of Leslie's points. She mentioned athletes, this phenomenon of athletes hiding their injuries for fear of losing playing time. The point that underscores is that not only are athletes more susceptible to this kind of abuse because of the injuries that they face, but also the stresses and the expectations that they're under are potentially more severe than other students involved in some other things. And that's a function of well, you know, for fear of getting run out of the county, I think we ask a little too much of our student athletes. We expect a little too much competition out of the sports that they're engaged in. I see it with my own children, my own daughter in middle school, where students experience such a serious level of competition that their mental health is wrapped up in the expectations that are laid out for them on the field. And that's a terrible situation that contributes to the toxic stress and anxiety that we talk about as another factor in all of this risk. So we find on the high school level more and more need to engage students in conversations about overall wellness as athletes. And opioid dangers are certainly part of that conversation, but it's also challenges in nutrition and eating disorders, and its challenges in the expectations they put on themselves and how they handle failure, how they handle risk on the field and in class, and whether or not they feel comfortable to even take those risks for fear of stumbling and stumbling catastrophically from whatever expectations are being put on them. But this toolkit's a fantastic resource, and it's not just a good resource for athletes. It's a wealth of information really for anybody about the dangers of opiates, but it does really speak to some of the specific risks that athletes face.
And in fact, I was going to say that it really should be really for anyone that has been prescribed an opioid. I will say, though, especially for those that are watching on Facebook as well as the live stream, is if you go to our website, which is www.safecoalition.org, all the resources that we're speaking about today are on that website. As well, if you needed to reach our office, it's 908-782-3909 for any of the programs. As I kept mentioning the resource table, but if someone's watching live, obviously they wouldn't be able to get that. So please, any of the information you can reach, anybody who answers the phone will be able to help you.
Leslie, I just have a follow-up. Are the programs also for younger athletes, for example, the Little League teams?
Yes, in fact, that's one of the things that we're very grateful for having a great team at Prevention Resources and our coalition, is that we're looking at people who use the parks. You know, how do we reach those athletes and all different age groups? And we've created a prevention program with an interactive game, so it's age appropriate. But what we found is the athletes are quite competitive. So we've know that the best way to reach them is through games and competition as a way to make learning a little bit more enjoyable. So please know that this is available for any age group.
Thank you. As we come to the conclusion for tonight's town hall, we want to ask the panelists one final question, and the question is that what have you learned personally from interacting with the audience today, and what specific actions might you consider as a result of today's conversation? So we won't go in any order. If anybody just wants to start, that'd be great, but we want to know, from hearing the reaction from the audience as well as the questions that we received, are there anything specific that you'd like to take away as a panelist?
I can go ahead and start. I think from this lady that was mentioning about how important it is with that peer, I think that is a big takeaway for me in particular. I know that we have been talking about working in a program together over at the high school and with our youth coalition, is working with young people and having them work on ways to cope, ways to make better decisions. And some of the things that we want to do, it just, in hearing you speak today, really affirms that is the right direction we need to head in. Is we don't necessarily need to talk about a substance in particular because each person might be choosing something different. But what we need to work on is how do we support one another? How do we help our teens cope? And how do we get them to make better choices as well as reach out when they need help?
Thank you. Anybody would like to go next?
Sure. To Leslie's point, I would say, that we have to work together, not in silos anymore. And over here, what I learned today is that, a mom is here who lost their kid, and we have someone who is in recovery right now. So we need to be able to see each other more and talk to each other and hear each other out so that stakeholders like me, like Leslie, and everyone here can, fix the problem, if even possible, a little bit. Thank you.
There's something really validating, I think, and that's a takeaway that I have whenever I'm in this kind of conversation with folks from all different sectors and people who come in from all different places. We know, we've heard several times the partnership. We're in this together. This is work that we have to do together. Schools are too often separate from this work when they are often on the front lines of this work. And we forget that everything that schools do teaches. So when a school engages with its community, it shows. It shows students what that engagement toward a solution looks like. And so that's an important thing. And it's validating to be in that work with folks who just want to get this on a better track. This is very different from the kinds of conversations we have about GPA and college acceptances and all of those other things. But this is, in a lot of ways, more important to us. Thank you.
Thank you. Yes.
Okay. I'm going to take away a lot of hope. When I first started advocating, we would not have gotten this many people to come out to anything that had opioid abuse in it. And I have to remind myself every once in a while that we have come a long way because, we all tend to look at how far we have left to go. And having a young person in the audience ask a question like that means that something is getting through to somebody. We do have to work together, but we also have to start asking for input from people who have not been at the table. We need to ask teenagers what is best for them. What do they think is best for them? We need to ask people in recovery, how do we help other people get there? We need to ask family members, what do you wish you had? Or what do you still need? All of these people with lived experience need a seat at the table, and I can see that we're moving in that direction. People are much more willing now to work together and to come out to things like this and look for solutions instead of just talking about the problem all the time. So I'm taking away some hope with me.
Yes, excellent.
And I'd just like to say, well, thank you again for inviting me, and I want to continue to challenge you as patients, hopefully not patients, but if you are a patient, to challenge your physicians, ask questions. Why are you giving this? What's the alternatives? I think a lot of times we have this paternalistic view of physicians, and I don't think that's always the best. I'd certainly challenge you to, ask your physicians, question them, and that will also make them better physicians for the next encounter they have. So I know whoever asked that oral surgeon question, I'm sure that should have been a question for the oral surgeon when that prescription was given as they were leaving. And if they forgot at that point, call them back, ask them. Just don't take it home and fill it, and then you have it in your medicine cabinet. So that's kind of one of the things I learned tonight. So thank you again.
Thank you.
Yeah, I think I'm going to look in my medicine cabinet at home and see what I got in there. Yeah. Thank you.
Use one of the collection sites. So we want to thank all of you for joining us here today and really starting the conversation, because today's only the start. Hopefully, this will be the beginning of many other conversations, many other people and groups working together. Last weekend, October 6th, Governor Murphy declared New Jersey as Knockout Opiate Abuse Day throughout the state. And when you walked in and at some of the display booths, there are opportunities for you to be involved in your own community. There are door hangers that we would ask you to take and spend a half hour, 45 minutes just leaving them on your neighbors' doors. It's a great way for them to become aware, first and foremost, what an opiate is, because that's a one panel, and then secondly, how opiates lead to, in many cases, to dependency. So we would encourage you to all take one of those and really make a difference in your own community as well. I just want to remind everyone to please complete your survey as a housekeeping measure, and you'll be entered to win the Apple Watch, and most importantly, have a safe drive home. Thank you.